The history of family planning is long and complicated. It dates back to the earliest days of humankind. There has never been a time when women and girls didn't want to have control over whether, when, and how many children they would have. Today and every day, we take stock of how far we've come, and for a moment, we celebrate the work we've done. The women and girls who have more autonomy, the giants who lent us their shoulders. There are few issues as complex as family planning. It involves developing contraceptives that women and girls will use with the support of their partners, ensuring that they can obtain the methods they choose, where and when it is convenient for them and at an affordable price. It is dependent upon the women, medical staff, suppliers, governments, donors, community health workers, and men and boys. It is affected by social norms, political will, religious practices, supply chains, crisis and climate situations, and issues of empowerment. But if we are to see beyond the complexity, there is one overriding reason we do this work. One woman. She is born with unlimited potential. She is our daughter, our sister, our mother, our grandmother, our ancestors going back to the beginning of time. Those of us working on family planning do so because of that one woman. We do it because we know that family planning is a public health success story. It is fundamental to the success of development of a woman, a family, a community, a nation, a planet. It reduces infant and maternal mortality, prevents HIV transmission and recourse to unsafe abortion. There have been many seminal moments in the history of family planning, from the ICPD meeting 25 years ago in Cairo to the 1995 Fourth World Conference on Women in Beijing, the London Family Planning Summits in 2012 and 2017 both catalyzed huge changes in how countries develop and advance their programs. Our community gains strength as our partnership with one another grows, whether we work on supplies or developing youth-friendly clinics or postpartum care, whether we work for a Ministry of Health or at a small advocacy organization. We are finding new and more effective ways to advance our collective vision. We stand with advocates and implementers. We sit at the table with young people and humanitarian workers. We meet with those working on HIV and cervical cancer and maternal health and safe abortion care. And we stand on the shoulders of giants. Giants exist, though they are not always big in stature. They are the wise women and men, the elders, the young people, the innovators, the ones who continue to do the hard work of family planning, even when they are exhausted. They lead us and they remind us why this work is important. Let's never forget the one woman born into the world in Abuja, or Caracas, or Mumbai, or Chicago, or Warsaw. She wants her turn at designing her own life, and she doesn't care about how the supply chain failed, or that there is only one method of contraception available to her as a consequence. She doesn't want to be told to come back next week when the clinic will possibly be open. She is ready today to move forward. We must not fail her. She could easily be a giant.